Hello and welcome to the HIMSS21 Global Conference and tonight's HIMSS Awards Gala. We're here this evening to celebrate the bright and the dedicated change makers that have led the way forward in support of our mission to reform the global health ecosystem through the power of information and technology. Our theme this year is to be the change. Whether you're a frontline worker, a healthcare IT specialist, a health technology innovator, you manage a small clinic or run a major hospital network, a healthcare consultant, a supplier to healthcare systems, or government leader focused on healthcare policy, you've been called upon to be the change and to lead the change far beyond what we ever imagined before COVID-19 ravaged across the world. During the past 18 months, many of you, all of you, have had to respond to the overwhelming challenges that have faced systems, communities, and countries. You've saved thousands upon thousands of lives. You've laid the foundation for a better and brighter future for health and wellness for everybody. I stand in awe of what you've achieved. Unprecedented circumstances have faced each and every one of you. And tonight, it is my honor and privilege to celebrate the individuals who have achieved uncommon impact through their tireless dedication and passion for transforming health and healthcare. Before we begin, and on behalf of HIMSS, I want to extend a special thank you to our sponsors, Cerner, LK, Epic, Innovacer, and Softtech. And now it's my great pleasure to introduce my friend and colleague, Bruce Steinberg, Managing Director and Executive Vice President of HIMSS International. Bruce?
During this difficult time, many of us have been touched by illness and hardship. I hope that you and your families are safe and healthy. Healthcare is always very personal, whether you're in Las Vegas or Leipzig. We're gathered today because we share a common mission to reform the global health ecosystem through the power of information and technology. I'd like to share some recent international highlights of our work to help drive this mission. HIMSS is an association of members like all of you, working to advance healthcare. Over the last year and a half, HIMSS International membership has grown sevenfold to almost 36,000 members, now representing a third of all our members. These members have joined our online conferences, our webinars, and media to share their key issues, learn about new digital solutions, and shape a new post-COVID agenda. As an example, we had record attendance at the HIMSS Middle East Digital Conference with over 30,000 health professionals. COVID-19 has been a wake-up call. Healthcare providers are committed to mapping their digital maturity with the goal of improving both clinical and operational outcomes. I'd like to highlight Germany, where a HIMSS-led consortium was selected to evaluate the digital maturity of all 1,800 German hospitals over several years, providing the government with a longitudinal view. This is a great example of the way HIMSS can help drive change. Also, as the healthcare industry is shifting to adoption, HIMSS is investing to support the development of digitally enabled workforce with projects around the world. One of the highlights is Thailand's endorsement of CA HIMSS and CP HIMSS for their national healthcare curriculum. Of course, there's much more to do, but we're tremendously thankful for the work that you, the HIMSS members, communities, corporate members, and healthcare workers have done over the past year. And I'm also very proud and honored that my team and I were able to support you in this. Together we can change, sometimes faster, sometimes slower, but constantly to realize the full health potential of every human everywhere. Thank you.
I couldn't be more excited to share this evening with you as we honor those who have committed their lives to leading the global health transformation. Tonight's award recipients are leaders, advocates, innovators, pioneers, educators, and care warriors who work tirelessly to revolutionize the ways we deliver health and to provide better outcomes for individuals and communities worldwide. With immense gratitude, we acknowledge these acts of service and sacrifice. That's why I'm honored to present the first award of the evening. Each year, the John A. Page Distinguished Fellows Service Award is given to one HIMSS fellow member who has made commendable and long-standing contributions to our society. This year's award recipient is Seppi Browning. I'd like to recognize HIMSS members who have achieved a rare status. Acquiring Life or Life Fellow membership is an outstanding demonstration of dedication, service, and a continued contribution to the field of health information and technology. Those achieving this status have contributed their thought leadership and expertise throughout their 30 or more consecutive years of HIMSS membership. Join me in honoring the dedication of these members.
HIMSS chapters are the very core of our organization. With 58 global chapters and over 800 local leaders, our volunteers are dedicated to making a positive impact through education, leadership, and advocacy across the healthcare spectrum. That's why I am thrilled to present our Chapter Service Awards this year. We recognize the immeasurable contributions of our member leaders through the Chapter Leader of the Year and the Chapter Advocate of the Year awards. These individuals have demonstrated significant leadership, extraordinary contributions to HIMSS chapters, society, and a commitment to driving thought leadership. And for our Chapter Advocate Award, it recognizes their dedication to advocacy in advancing public policy in their state, locality, territory, or province. And now let's hear what they have to say.
I would describe the Georgia chapter of HIMSS as resilient, adaptable, and inviting.
Moving the needle forward in advocacy is an exciting world. There are two factors in doing this. One is defining what needs to be moved forward, and two, bringing the appropriate team together to accomplish the task.
The Chapter of the Year Award recognizes chapters that have strongly influenced their region in a meaningful way through health information and technology-centered events, education, initiatives, collaboration, and advocacy. We asked our small, medium, and large chapter award recipients this question: how has your chapter made changes that have kept them present in the community and to the members they serve?
The challenges of the past year provided the push for our chapter leaders to create a robust schedule of digital programming. This change improves our service to HIMSS members with content easily accessible both in population centers and across rural areas of South Dakota.
The HIMSS Midwest Gateway chapter improved the quality of our educational programs events we hosted. We put more emphasis on advocacy and advocating for systems that protect patients and improvements in health IT. And we created a HIMSS chapter scholarship fund to create a pipeline for future health IT leaders.
Georgia chapter of HIMSS has always been an adaptable chapter, and because of the pandemic, our committees were able to pivot without skipping a beat. Our board of directors has always been hyper-focused on ensuring that chapter members get the most value out of their membership. As we move forward into in-person events, I know our chapter will remain dedicated to making our Georgia members our primary focus.
Since 1994, just 96 organizations have received the Nicholas E. Davies Award of Excellence. These organizations have leveraged information and technology to drive groundbreaking achievements, leading to increased quality and clinical outcomes and marked improvements in patient experience. Meeting these requirements is no small task. That's why it's our great honor to recognize organizations that are receiving the 2021 Nicholas E. Davies Awards of Excellence. Known as the Davies Awards, this program pays tribute to outstanding organizations around the world that have leveraged information and technology to drive and redefine evidence-based best practices so that others can learn, adapt, and improve population health and patient outcomes. Please join me in congratulating these 4 extraordinary organizations, all recipients of this Enterprise Award.
Let's honor our volunteer leaders, those who guide the organization and excel us to new heights. These leaders have been selfless with their time, expertise, and efforts to help HIMSS transform health across the globe. We celebrate this year's Board of Directors Service Award recipients.
If your organization achieves HIMSS Stage 7, you know that this is not a trivial effort. Our next award recipients are organizations that have made significant strides in their digital health transformation journey. Achieving Stage 7 illustrates your commitment to continued digital health optimization. And by doing so, your organization is better able to meet the needs of your community through sustainable health equity, realizing greater operational efficiencies and clinical quality capabilities that drive outcomes, and ensure increased patient-centered care and workforce engagement. The following organizations have achieved Stage 7 for HIMSS MRAM, OMRAM, or AMAM maturity models. Join us in recognizing and congratulating these exceptional organizations that have committed to and achieved this coveted status. Here are this year's Stage 7 award recipients.
strong, passionate, confident, empowered. These are a few words that capture the hard work and determination of our most influential women in Health IT award recipients. 2020 was a challenging year for us all, but it delivered defining moments for women, with scientists, inventors, prime ministers, and vice presidents breaking the glass ceiling in industries around the world. Tonight, we celebrate role models, mentors, leaders, and pioneers. We recognize women in various career stages, women who are nominated by their peers to honor their influence, inspiration, and persistence in transforming health and healthcare for everyone, everywhere. Let's meet this year's most influential women in Health IT award recipients.
I am ambitious.
I am unwavering.
I am resourceful.
I am ingenious.
I am resilient.
I am innovative. I am unstoppable.
We
are
the most
influential women
in Health
IT.
Danke.
Medase.
Tusen takk.
Thank you very much.
Dziękuję.
Bardzo gut. Kiitos.
谢谢你.
We just want to say thank you.
Nurses are on the front lines of every healthcare battle, displaying knowledge, compassion, dedication, and enduring resilience. Nurses support patients and providers in their acute decision-making, and nurses use technology and swift intellect to make an immense difference in their organizations every day. The field of nursing informatics has been pivotal in driving the implementation of various technologies across the healthcare ecosystem. Nursing informatics professionals bridge the gap between clinical and technical perspectives and serve as collaborators across the care continuum. But the number one priority in nursing informatics is prioritizing the safety of patients and the quality of their care.
Every year, we honor one nursing informaticist who demonstrates significant leadership contribution by optimizing health engagements and care outcomes through information and technology. I am happy to be here with ANI representative Nancy Beal as we have the privilege of presenting the HIMSS ANI Nursing Informatics Leadership Award.
The HIMSS ANI Nursing Informatics Leadership Award recipient is jointly selected by the HIMSS Board of Directors and the governing directors of the Alliance for Nursing Informatics. Nursing leadership is invaluable, and I am honored to acknowledge the critical role nurses play in improving patient care and transforming health. And now, here are the HIMSS20 and HIMSS21 award recipients.
Well, thank you, Nancy, for the honor of receiving the HIMSS ANI Nursing Leadership Award. I am just so honored to have been nominated and accepted to receive this award last year. And I'm so honored to have been able to work with some of the great minds in our field in nursing informatics. And they've made my job so easy because they are the true leaders. And I could name a few, but if I started naming names, I'd leave somebody out. So really, I just want to say that I've been impacted by so many people who have just shaped my career and helped make, allowed me to be the best person that I could be in my job and in this field. And I just thank you so much for this honor.
Hi, y'all. And my apologies for not being there to be able to share this wonderful celebration with you. But my rheumatologist has recommended I not travel yet, so here I am. But I am so honored that you have chosen me for this Informatics in Nursing Award. You know, back in 1994, I was stumbling around, having just finished my master's, figuring out what to do with my career when I discovered a magazine called Computers in Nursing, and the rest has been history. I've had a wonderful, wonderful career. I've been able to meet and make so many friends inside of HIMSS. I've served multiple roles, not only in HIMSS, but in the American Nursing Informatics Association and for the American Nursing Association. And it is my honor to be accepting this award this evening and to say thank you to all the wonderful people who have helped me along my way. Y'all have a wonderful rest of the celebration, because I know HIMSS conferences and y'all are going to be having fun. Thanks again, and I will see you.
Every year, we honor one physician, an individual who's shown extraordinary leadership in driving better care outcomes and unmatched commitments to developing better relationships with their patients. I'm happy to be here with the chairman of AMDIS, Howard Lander, as we have the privilege of presenting the HIMSS AMDIS Physician Executive Leader of the Year Award.
This award recognizes physician leaders who champion information and technology to optimal strategic impact. The award recipient has been jointly selected by the Board of Directors of the Association of Medical Directors of Information Systems, or AMDIS, and HIMSS. Please join me in congratulating both the HIMSS20 and the HIMSS21 award recipients.
I am truly honored to receive this acknowledgement and to share with you today a bit about my enjoyable and varied career in informatics. While I've never considered myself a techie, I've long appreciated the potential of technology to improve health and to help me take better care of my patients. After a few years dabbling with computers in the 1980s, I had my first opportunity to use a homegrown EMR while working in the ER at Kaiser San Francisco. In the 1990s, I was part of a small team at Sutter Health that implemented the first Epic EMR in California, followed by the first EMR patient portal in the country. After spending much of the 2000s rolling out Epic at Sutter, I shifted my focus to interoperability, first through regional collaboration and then nationally through work with Epic, the Sequoia Project, Care Equality, and others. In 2017, I was fortunate to be appointed to the ONC's Health IT Advisory Committee, where I've had a chance to really deepen my understanding of the key role of policy in advancing health IT. At this point, I have tremendous gratitude for the opportunity to continue to work with so many creative and caring people. I really remain optimistic regarding the potential of IT to improve health, but also appreciative of the challenges we face to maintain the humanity that's such a critical component of care and healing.
I'm truly honored to receive this award because it comes from an amazing group of passionate, innovative, and dedicated physician leaders who have taught me so much. I still remember the first time I went to the AMDIS Symposium in Ojai with Chris Longhurst and felt completely overwhelmed by all the new faces and how much I had to learn. The feeling of having so much to learn hasn't gone away, but now those people are some of my favorite consultants, confidants, and co-conspirators. I'm also grateful to Stanford Children's Health, our phenomenal information services team, and their complete dedication to improving the lives of children and families. Ed Kopetsky, Lisa Grissom, Zalon Lee, Shanna Perales, and many others have provided endless mentorship, teaching, and support as we work towards these goals together. And of course, I'm also incredibly thankful to the patients and families who entrust us with their care and who partner with us to help elevate the care for children and families everywhere. Finally, I just want to thank my husband, Tom, and my wonderful boys, Jake, Logan, and Ollie, for not only putting up with, but fully supporting my crazy schedule and passionate pursuits. Thank you all.
Catching up from 2020, it is time to recognize the role that CIOs play in leading digital transformation across the health ecosystem. The Chime HIMSS John E. Gall Jr. CIO of the Year Award is given to a Chief Information Officer who demonstrates significant leadership. The honoree is selected jointly by the boards of directors of the College of Health Information Management Executives and HIMSS. Hal Wolf is joining me to welcome our 2020 awardee.
Thank you, Chris. And I'm pleased to honor the 2020 recipient of the Chime HIMSS John E. Gall Jr. CIO of the Year Award, Mark Prost.
Thank you, Hal, and thank you, Chris, my good friend. I want to thank HIMSS for awarding me with the CIO of the Year Award. What a wonderful honor, and I'm so appreciative of the people at HIMSS. I love HIMSS and the great people that are there and the wonderful gatherings that we have on an annual basis. These are my friends and my colleagues. I want to thank the CIOs of healthcare who have dealt with so much over the last year and have been such a wonderful example and colleague of mine. I'm so proud of the use of technology and the creative use of data that has gone on over the last year. Thank you for all the CIOs. You really deserve this award. And I want to thank Intermountain Healthcare and the 11,000 associates that worked with me and supported me over the years. I love Intermountain Healthcare and I love this industry. Thank you all for being so supportive of me. And finally, I'd like to thank my family who have supported me over the years in this wonderful career and this wonderful industry of healthcare. Thank you all very much.
One of the disappointments of last year was that we never had a chance to celebrate the HIMSS Award recipients for 2020. In addition to Gregory, Stephen, and Mark, there was a full slate of leaders and innovators in 2020 whose achievements were worthy of the highest recognition. It's great to finally be able to honor them here tonight. To all of the HIMSS Award recipients from 2020, thank you and congratulations.
Be the change that you wish to see in the world. That challenge, spoken by Mahatma Gandhi, applies to our next group of award recipients. How do you celebrate change? And how do you recognize true change makers? We answered these questions with the new awards program. The HIMSS Changemaker in Health Awards honors inspiring senior healthcare executives who rigorously challenge the status quo in their journey to build a brighter health future. Award recipients were determined fully through a public vote by people like you and me, making the HIMSS Changemaker in Health Awards uniquely powerful as it represents the voice of the health community. We asked our inaugural Changemaker Award recipients, what motivates you to be the change? Let's hear what they have to say.
Quite simply, I love what I do. I really enjoy bridging the gap between the clinical and IT teams and designing innovative ways to engage our patients in an effort to improve their health outcomes.
As long as I can remember, I have cared about impacting those beyond myself, knowing that something needed to be done and finding a way to do it. It never mattered if I had the capability or capacity to execute. It never mattered if I even knew what I was saying yes to. That opportunity is what motivates me every day to be the change.
It's hugely motivating to transform healthcare through innovation. Big data, informatics play a huge role to make healthcare affordable, accessible, and precise.
Digital health is saving lives now and leading a paradigm shift in how we diagnose and treat mental illness, the most stigmatized part of our health. Digital health is transforming lives, and that's what's motivating me every single day.
The future of healthcare and wellness of our communities is dependent on our ability to change today. I am inspired and encouraged by my team daily, who is equally committed to transforming healthcare delivery for our community, understanding that being a change maker is not about the size of your community or the budget of your organization. It relies only on the commitment to change.
Throughout my career, I've worked with healthcare professionals that care deeply for their patients in a highly complex system that is very difficult to navigate. Each day, my team and I dedicate our work to trying to improve that healthcare delivery system through change for the patients and the providers that are caring for them.
In Lin-Manuel Miranda's Hamilton play, there's a song entitled "History Has Its Eyes on You." That song and this statement are profound for me because it is in that sentiment that I am motivated to be a change each day. There's a line that says, "I know greatness lies in you," and this applies to us all. Greatness lies in us, and history is watching us to see what we produce. My part is only a fraction of if we collectively put our work together.
I became CIO. I saw up close the issues with healthcare delivery, and I've always believed that we could do better. Every day, I strive to make healthcare easier to access, easier to navigate, and easier to participate in. And that drives me to push change every single day.
What motivates me is simply the millions of veterans that are counting on us day in and day out to deliver a quality care and an electronic health record that supports delivering that quality care now and well into the future.
We are all consumers of healthcare, and it needs to be made easier to access and more cost-effective. As Banner Health CIO, I have the opportunity to drive that change through innovation and hiring the best and the brightest IT talent.
Congratulations to our first ever 2021 Changemaker Award recipients. And now it's a special privilege to honor the very first Changemaker Lifetime Achievement Award recipient, George Halverson. I don't know anyone who has done more or worked harder to create a more connected world than George. A true thought leader in the world of healthcare, George has been at the forefront of efforts to transform the global health ecosystem through the power of information and technology for nearly half a century. George has been recognized as a critical early proponent of electronic medical records and the use of the information they derive in the care of tens of millions of people. The CEO of Kaiser Permanente since 2002 until 2014, and the CEO of Health Partners in Minnesota for 17 years before that, George has served as chair of numerous commissions and organizations, including the first 5 Commission for Children and Families for the state of California. He's the author of many books on healthcare delivery and reform, early childhood development, and human interaction and understanding. Today, George continues to serve as CEO of the Institute for Intergroup Understanding, the organization he founded in 2012 to address issues of racism, prejudice, discrimination, and conflict. It is a special honor for me to give this award. Throughout my career in healthcare, George has been a mentor, an inspiration, a colleague, and, I'm proud to say, a friend. When I learned that George had been selected as the first recipient, I couldn't have been more pleased or thought of someone more deserving. So it is my great pleasure to present the first ever Changemaker Lifetime Achievement Award to George Halverson.
HIMSS is doing extremely important work at this point in time. We are going to be so dependent on system support, and we're now going to be able to use that system support to look at DNA, RNA, artificial intelligence, care patterns, and really enhance care in important ways at multiple levels, all supported by systems. So you're in the right business at the right time. And thank you hugely for this award.
Congratulations, George, and thank you. And thanks to everyone who made this evening possible. After more than a year of disruption and uncertainty, it really has been wonderful to come together to celebrate this year's awards recipients and to simply enjoy each other's company once again. On behalf of my fellow presenters and HIMSS, congratulations to all the changemakers who were honored here this evening. I also want to extend my deepest appreciation to everyone who helped make this year's award ceremony possible, including our HIMSS Foundation contributors and our sponsors, Cerner, LK, Epic, Innovacer, and Softtech. Whether you're here in person or joining us from a distance, thank you for your support and encouragement tonight and throughout the year.